You know, many parents might be a little uneasy about sending their kids back to the classrooms. Others maybe might not fully understand how this new Delta variant is impacting kids. So joining me now to talk more about that and other things COVID related, we've got physician leader at Novant Health Children's Institute, Dr. Catherine Olmstead. So Dr. Olmstead, thanks so much for joining us and taking the time. I wanted to start off with some of the trends we're seeing with COVID in kids, and we've kind of been getting bits and pieces from maybe local health departments, even looking at state data. It does seem like we are seeing more kids getting sick with COVID than we were before. Is this Delta? Is this the Delta variant that is worst in kids? What are you noting on that front?
That's exactly right, Vanessa. We have seen a dramatic increase in the number of diagnoses of COVID in children over the past couple of weeks. We don't know yet if the Delta variant is more severe in children or if we will find that it acts similarly to the prior variants that we saw. Usually children have initially a pretty mild illness from COVID, and it's not for a few weeks after infection that we see severe illness with MIS-C, the multi-inflammatory syndrome. So it remains to be seen over the next few weeks if we find that this Delta variant is more severe in children. We just this week started to see an increase in hospitalizations in our area with children with COVID.
And I feel like some people might feel like, you know, given all that we've seen so far of this pandemic, that children are largely maybe exempt from the impacts of, you know, severe impacts of COVID, but that's not the case for some kids. And mask mandates, you know, that's been a hot topic for folks as, you know, the school districts talk about going back to school. Some are making masks optional, leaving it up to the parents. Some are mandating them. What would you recommend? Should children be masking inside schools?
Vanessa, I know that's a hot topic, very controversial question, but we have data that really makes it very clear that children need to wear masks in schools this year. We've seen 4 million cases of COVID in children, 4,000 cases of MIS-C, which is the severe multi-inflammatory syndrome, and had 400 deaths in children from COVID. So it would be extremely important for us to mask. We are seeing levels of infection similar to where we were last summer in our community. We are considered in a high spread area now. If we were where we were a month ago, I was very hopeful that possibly vaccinated students could go back to school without masks. But due to multiple factors, we're in a situation now where we are in a high spread area. The AAP recommends that all students and teachers wear masks, whether vaccinated or not. And the CDC also recommends that everyone wear a mask indoors at this point.
And something else that is, you know, a big question that parents are trying to mull through when it's time for their kid, if they're not already eligible, when it's time for their kid to get the COVID vaccine, would you recommend that? Do you have children? Are they vaccinated?
I vaccinated my children the day that it was approved for 12 and up, and it was a very happy day for our family. Brought a lot of safety and reassurance to us, and we've been very, very fortunate to be in that situation. Unfortunately, it will probably be closer to Thanksgiving before children 5 to 11 will be able to get the vaccine. And we know with MIS-C, the most severe form of COVID, which we see in 1 in 1,000 COVID cases, the peak age for that diagnosis is age 10. So it's incredibly important for our community to protect our unvaccinated children at this point.
All right. Dr. Catherine Olmstead, appreciate your time. Hope you stay well. Hope you have a great weekend.
Thank you, Vanessa. You as well.
Thanks.